Assalamu alaikum. My name is Sayyada Mahanur Musin, and my topic for presentation is um, assignment on paracetamol. So first of all, let me tell you what this drug tells about. Paracetamol is also known as acetaminophen, and it is a medication used to treat fever and mild to moderate pain. Paracetamol is significantly relieves pain and acute migraine, and not only, but it is also called as Panadol or Tramadol, and it is also used to relieve pain and acute migraine. The main indications for this drug is to treat moderate pain from headaches, menstrual pain, toothaches, backaches, cold, flu, and to reduce fever also. Main side effects: any allergic reaction which causes rash and swelling, flushing, low blood pressure, fast heartbeat, blood disorders, thrombocytopenia, liver and kidney damages. How can we adjust the dose of paracetamol? How much we have to intake, it depends upon our age, weight, and type of paracetamol you are taking and how strong it is. So basically, there are different dose adjustment for adults and children. For adults, it's about 1 to 2 tablets, 500 mg every 4 to 6 hours. But for children under 16, need to take a little lower dose depending upon their age and weight. Whereas the dose interaction, following are some mentioned, as you can see, are some points that I've mentioned for the dose interactions, which involves paracetamol may increase chloramphenicol concentration, paracetamol excretion may be affected, and plasma concentration altered when given in probenecid. Anticoagulant drugs, warfarin dose may require reduction in paracetamol, and anticoagulants are taken for prolonged period of time. Drug toxicity and mechanism. In case of paracetamol overdose, the sulfate and glucuronic pathway becomes saturated and more paracetamol is shunted to the cytochrome P450 system to produce NAPQI. As a result, hepatocellular supplies to glutathione become depleted. As the demand for glutathione is higher than its rejuvenation, NAPQI therefore remains in its toxic form in the liver and reacts with cellular membrane molecules, resulting in widespread hepatocyte damage and death relating, which leads to acute liver necrosis. Paracetamol pharmacoeconomic rates of paracetamols are given below, and it's well mentioned and explained here. When it comes to my case, I have a case of paracetamol toxicity, which tells that 24-year-old non-pregnant female present 40 minutes after ingestion of 18 grams of standard release acetaminophen. She has no complaints and decided to seek care after telling her boyfriend about the ingestion. She has no significant medical history, is an oral contraceptives and denies drug use. Her vital signs are within normal limits and her exam is unremarkable other than she is careful. So basically my assessment for this case is that it is straightforward presentation of acetaminophen poisoning. Patient who ingest more than 15 grams of acetaminophen are considered at risk of liver injury and are likely to treat with acetylcysteine. And my plan for this case is the decision to administer N-acetylcysteine NAC is based on 4-hour acetaminophen concentration. The 4-hour mark was selected to assure that acetaminophen absorption had occurred. The history of 18 grams of ingestion suggests a potential for toxic ingestion if the total dose is absorbed. whereas activated charcoal has shown benefits and she agreed to take activated charcoal at every 4 hours. A serum acetaminophen concentration was measured at 110 mc per ml. Thank you so much. That's all for my presentation and for my assignment on paracetamol. References are given here. Thank you.